First, some health headlines. Joining us now is professor at Northwestern University Medical School and Morning News medical contributor, Dr. Lauren Streicher. Thanks for being with us.
Good morning.
All right, first topic, some new information about polycystic ovarian syndrome, which is talked a lot about on TikTok.
It's everywhere.
Okay.
Polycystic ovarian syndrome is actually pretty common. 1 out of 10 young women have polycystic ovarian syndrome, which, we're talking women that have irregular periods, some fertility problems, hair growth, acne, and some new recommendations have just come out, because one of the problems with getting diagnosed is that it has always required that these women get an ultrasound because their ovaries have lots of little cysts and are enlarged. So this is how the diagnosis was made, but this also presented a real barrier because women were not getting diagnosed. So the new criteria
because they didn't want to get ultrasounds?
Yeah, because that's just, you got to make the appointment, you got to go to the ultrasound place. It's not always so easy. Their insurance may not cover it. So a lot of people were undiagnosed. And it's important to get diagnosed because polycystic ovarian syndrome isn't just associated with infertility and extra hair growth. It's also things like heart disease, diabetes, increased risk of uterine cancer. So the new criteria says you don't need the ultrasound. Instead, you can get a blood test called AMH, anti-Mullerian hormone, which is something you can get in your doctor's office. And anti-Mullerian hormone basically tells you how many eggs there are in the ovaries. And polycystic ovarian syndrome, you have increased eggs. They don't get released, which is why there's fertility problems, but there's lots of eggs there. So their AMH level is higher. So that's new criteria. The second thing that's come out in polycystic ovarian syndrome is that we used to tell women, once you go through menopause, you're done. You don't have to worry about this anymore. This is in your rearview mirror. And now we have a lot of emerging evidence that a lot of the problems, like the increased risk of diabetes and heart disease and uterine cancer, continue into the post-menopause years, which is actually the topic of my podcast that's going live tomorrow. So
all righty.
Big topic.
All right, and with legalization of cannabis, more seniors are overdosing and ending up in the ER.
This really isn't a surprise, but now we have some good numbers that have just come out. And these are actually Canadian numbers, but it mirrors what's going on in the U.S., that emergency room visits have tripled because of cannabis use in men and women over the age of 65. And so there's really kind of two categories. One is the inadvertent overdosing, meaning they go to their daughter's house for Easter, they think, oh, I'll have some candy. They head over and they think what's just, candy turns out to be gummies. And suddenly an hour later, grandpa's walking around in a stupor and confused and stumbling, and they think he's had a stroke instead of the fact that it's a cannabis overdose. But they're also seeing not inadvertent use, but people who are intentionally using cannabis to help with the aches, the pains, the sleeping, but they get into trouble. Because first of all, cannabis is a lot more potent now than it was 20, 30 years ago when they might have been using it recreationally, but also seniors tend to metabolize it more slowly. And in addition, they might have other medications that are interacting with it or other medical conditions. So we're seeing a lot more of these emergency room visits and people getting into trouble. So if you go to your daughter's house, don't eat the candy or the brownies without asking, right?
But if a senior needed it, do you do half the dose of a regular adult? Or what do you tell them to ask their doctor?
That's exactly the point, is that you need to go a lot lower dose and a lot slower, particularly with the edibles. And then with the ones that you inhale, you've got to be really careful, because in seniors we're seeing arrhythmias, pulmonary problems. So it's not that you can't do it, but it's not like it's this free-for-all, that it's just going to be easy and no problems.
All right, STI rate in older adults.
Yeah, I was thinking, was there a relationship between doing the more cannabis and getting the increased STIs? But there's not. But it just so happens that in the last 5 to 10 years, there's been a dramatic increase in sexually transmitted infections in all age groups. But the biggest rise has been in women over the age of 55. So you say, okay, well, why is this going on? Well, first of all, because the tissue's thinner, it's more vulnerable. That's problem number one. Problem number two is, who are women over 55 dating? Guys who are over 55, who very often are not going to use a condom, because number one, you're not as worried about pregnancy. That's kind of off the table, obviously. But also for older guys, they won't or they can't. I mean, let's face it, they put the condom on and the party's over. So they just decide, okay, that's not going to happen. But the third thing is, these women are not getting screened, because women over 55, they're not going to the gynecologist anymore. They're told, well, maybe you don't need a Pap test. So they're not going in. The doctors aren't asking, because they think, oh, well, she's over 55, she doesn't need it. And so she's just not getting the test. So we're looking gonorrhea, chlamydia, and syphilis. Syphilis is, I know you think syphilis, like that's
They're
like,
sleeping
like
with Al
Christopher
Capone?
Columbus or something like that, of historical interest. But it turns out there's been a 7-fold increase in specifically syphilis in over the age 55. So yes, get screened. You're not going to get yes, so you need to ask for it.
All right, Dr. Streicher's Inside Information Podcast, Menopause, Midlife, and more. Check that out. Thanks for being here.
Thank you. Time for On Top.
Hey, Anna.
This is a very special art gallery because it's at Little City Foundation, and for decades, it has been putting